In mid-80s, India faced a new public health threat of HIV. Taking cognizance of the situation, the Government of India took timely steps by launching the National AIDS and STD Control Program in 1992. Driven through a robust strategic information system of monitoring, surveillance and research, NACP has emerged as a globally acclaimed AIDS response. This has led to new HIV infections decline by 46% between 2010 and 2021 against the global average of 32%, and the AIDS-related mortalities declined by 76% against the global average of 52%. The new initiatives of the Government of India has further augmented the national AIDS response. Today, the HIV prevalence in India is one of the lowest among the countries across the globe, with prevalence as low as 0.21% in 2021. NACP is able to keep more than 99.5% of adult population in India HIV-free through its awareness generation campaigns, 1097 National Helpline and multi-sectoral engagement with key stakeholders. NACP covers around 80 million people comprising sex workers, Hijra or transgender population, men who have sex with men, injecting drug users, prisoners, migrant workers, truckers, at-risk population, adolescent and youth, pregnant women with prevention messages, and people infected and affected by the HIV in both rural and urban areas through care and support services. Services are being provided through over 34,000 HIV counseling and testing centers, more than 1,150 Suraksha clinics. Treatment is being provided through more than 650 ART centers and 1,250 Link ART centers. NACP is the central sector scheme of Government of India and currently is in its 5th phase since April 2021. Program has evolved over the last 30 years with many game-changer initiatives like enactment of HIV and AIDS Prevention and Control Act 2017, Test and Treat Policy, Universal Viral Load Testing, Community-based Screening and Transition to Latest Treatment Regimen. Intensifying the response further, NACP 5 introduces newer strategies like introducing dual test kits for HIV and syphilis, setting up of Sampurna Suraksha Kendras for providing services through a single window model for population at risk of HIV and STIs covering prevention, test, treat, care continuum. Interventions on virtual platforms are also being explored to augment the coverage among the high-risk and at-risk populations. The current phase will anchor the national AIDS and STD response, not only to expand the coverage of the program, but also to take it to the last mile towards the attainment of the Sustainable Development Goal of ending the HIV/AIDS epidemic as a public health threat by 2030.